It doesn't seem to be instantly available, so I apologise for that, but I'm mindful of the time and I'm mindful that we need to move on. So I will rectify that for the next meeting. But I would like to welcome you all to today's meeting, and I would like to begin by sharing a presentation and running you through a brief agenda. Let me just... So today, obviously, I want to introduce myself and my new role and the purpose of the CHIMe network. And then we're going to be learning from SNEE, South Suffolk and North East Essex ICB, about their creative health legacy and learning. We'll have a short break. And then we will then go into breakout rooms where we will do some reflection and have an opportunity to talk. And then if we've got time, we'll have a closing question Q&A. And then I'll talk you through what the next steps are for CHIMe. And then we're aiming to close at 11:30. If we can keep to time, that would be great. So I'm going to start by introducing myself. I'm the new Creative Health and Equity Lead for Norfolk and Suffolk. My position has been funded by the Culture, Health and Wellbeing Alliance, Suffolk County Council and Suffolk Artlink for 2 years until June 2027. And the purpose of my role is to lay the foundations for creative health delivery whilst the region undergoes healthcare restructuring, local authority restructuring and devolution. I'm sure some of you will have seen in the news at the end of last week that the devolution timeline now potentially looks slightly different, but I don't have any further information on that just yet. So the 10-year vision that we're working towards here is to develop Norfolk and Suffolk into a creative health region. We want it to be a place and a space where creative health work is valued and where it's advocated for and where we deliver it cross-sectorally across all the sectors involved in healthcare, social care and public health. But equally looking at how we also create workforce development and pipelines to bring new people into the sector to allow us to deliver this work safely and equitably. So for those of you who are unfamiliar with what creative health means, the National Centre for Creative Health defines creative health as creative approaches and activities which have benefits for our health and well-being. And there is a spectrum of activities that fall under this creative health label that range from kind of your everyday creative activities, such as knit and natter groups or gardening within your local community, to more specialised non-clinical interventions, such as dance for Parkinson's or singing for lung health. My role is going to be focusing on the evidence-based non-clinical interventions and specialist pathways that have been developed and implemented by creative health practitioners across Norfolk and Suffolk. My mission is to generate strategic and infrastructural support and advocacy for creative health to ensure that the role of creative health in addressing health inequalities is understood, valued and developed, to develop co-design projects alongside health and social care providers, ensuring long-term commissioning, delivery and evaluation, to build an effective creative health funding model that facilitates large-scale long-term funding whilst also making funding accessible to small grassroots organisations and freelancers, to ensure workforce development pathways and sector wellbeing and CPD support is established to grow the sector in moving towards a creative health region. This is all underpinned by the values of the Culture, Health and Wellbeing Alliance, their creative health quality principles, which are person-centred, equitable, safe, creative, collaborative, realistic, reflective and sustainable. And I really want to focus on the equitable piece today, We've got lots of different people that are joining the call from lots of different sectors. And I think it's really important that we value each other's expertise and experience, and that we honour that. When working cross-sectorally, we can sometimes dismiss what other people might be bringing to the conversation. So I'd really like everybody to be mindful of that when they're in the breakout rooms, and to honour everybody's expertise that's calling in today. So my goals primarily are to understand, develop, advocate and build community to enable this system change to take effect. So understanding the landscape in which this work sits, developing cross-sector partnerships, advocating for creative health and the benefits for all, and to build a community to develop knowledge exchange, partnership working and a new creative health system for Norfolk and Suffolk. And that's where CHIMe comes in. So CHIME, which stands for Creative Health Interest Meetings, is a new initiative designed to bring together professionals from the arts and culture, VCSE, healthcare, social care and public health sectors who are interested in exploring and developing and sustaining creative health practice across Norfolk and Suffolk. This aligns with the community strand of my work. And through these network meetings, the aim is to develop a cross-sector understanding of the landscape in which creative health sits, to develop strong cross-sector partnerships that advocate for creative health and the benefits for all, and to build a community to develop knowledge exchange, partnership working, and a new creative health system for Norfolk and Suffolk. So today's meeting, I would like to introduce you to Susannah Howard, Rachel Jennings and Liesl Kennedy from the Suffolk and North East Essex ICB board to work with us today to understand the learnings and the legacy of the creative health work that's been happening across Suffolk over the last 10 years.
Okay, thank you very much, Claire. That's really helpful. So I'm Susannah, and just to introduce myself, I do absolutely link into the NHS Integrated Care Board, but my role's a little bit bigger than that, because my job over the last decade, believe it or not, has been to hold together our health and care system, which is of course much broader than just the NHS Integrated Care Board. It's also spans the huge diversity of different organisations that contribute to health and care, including, very importantly, our voluntary and community sector as well. So I actually have an arm into, you'll see from the kind of covering slide, not just the NHS Integrated Care Board, but also Suffolk County Council and Essex County Council in terms of supporting that. So I work with 3 co-chairs of our Integrated Care Partnership at the moment. And the context for this conversation this morning is really to have a bit of a chat about how things are changing, because there's an awful lot changing in the health and care landscape all at the same time at the moment, as you'll see. So I'm going to try to do my best to try and give you at least an overview of how much change is underway. I can't explain all of it, and some of it, as Claire just said, is very kind of new news indeed, and some of the changes that are underway at the moment are really just only beginning to emerge. So I think it's fair to say I've been around a lot of years, not obviously as young and youthful as I appear, but I have never seen a level of change in health and care to the extent that we're seeing at the moment. So I'm going to give you some idea of this, about what that kind of looks like. So first of all, we've got a number of things that are changing in terms of the way that kind of health and care is organised at a national and regional level. So you might remember that back in March this year, the government announced that it was going to be abolishing an organisation called NHS England, which is the kind of overarching organisation that organises the NHS in this country, and that its role would integrate with the Department for Health and Social Care as well. So what that means is that actually there'll be a very significant reduction in the number of people working in those organisations, but also that there'll be a different role for how regions would work in the future. And we've got kind of some new plans for that. They're going to be predominantly kind of overseeing the delivery of things like hospital services and kind of NHS trusts. We've got a new NHS 10-year plan that was published in July. We're still waiting for a delivery plan for that. And a number of other announcements that you'll have probably seen as well, including things like, in actual fact, integrated care partnerships. And I'm currently the director that supports our integrated care partnership across Suffolk and North East Essex. The government has said that it doesn't see a need for those in the future. And also local health watch organisations and things like that. Now, of course, all of those things, as I'll come up in a minute, are subject to changes to the Health and Care Act. So the government is signalling that it's planning to make some changes to the Health and Care Act. And also another thing worth keeping your eye on is the fact that the way that the CQC works is also changing as well. So there's a lot going on in terms of that kind of national landscape around health and care. Another big area of change at the moment is around NHS integrated care boards. So again, back in March, the government signalled that it wanted NHS integrated care boards to reduce their running costs. So it's not the amount of money that they spend in the local system, it's basically the kind of staffing costs predominantly that run the organisations by 50%. Now, what that's triggered is the fact that it means that basically for some, they've got a maximum spend in terms of how much they can spend per head of population on running the organisation. So it basically means that integrated care boards with a very small population aren't viable anymore. So that's led to a kind of bit of a restructuring around the footprints of integrated care boards across the country. We're going to go from having 42 to around 26 or 27 nationally. I think we're down to 26 now. And for the east of England, where we've had 6 NHS integrated care boards and therefore 6 integrated care systems in the past, we're going to go to having just 3. So we're going to have one for Norfolk and Suffolk, one for Essex, and the other one, which is Central Eastern, spans Cambridgeshire and Peterborough, Bedfordshire, Luton, Milton Keynes, down to Hertfordshire as well. You can imagine that that's then meant that we've needed to make some changes to director appointments and so on. And there's now a very significant restructure for staffing, which is underway. For Norfolk and Suffolk, to give you some idea, in actual fact, the reduction in staffing is about 60% cut in terms of staffing for NHS integrated care boards. And the backdrop to this is that what the government would like is for integrated care boards to focus on being what they call strategic commissioners in the future, which is really kind of at a strategic level, understanding the needs of the population, people and communities, and commissioning services with a particular emphasis around neighbourhood services for the future. So lots of change there. NHS trusts also changing. So one of the things that's been talked about is that in the future they could work towards having a role as what's called an integrated health organisation. So that would be, if you like, having a contract where, if you like, they might be coordinating kind of health and care more for a local population. And there's a number of sites around the country that of trusts around the country who are, if you like, early kind of first kind of wave potential IHOs. We don't have any in our local area. But also NHS trusts have also been asked to make significant reductions to their corporate staffing costs as well. And we've now got a kind of new framework for performance ratings for trusts as well. There's something called National Oversight Framework as well. In Suffolk and North East Essex, you might be interested, there's been some work around an acute and community sustainability review to make sure that our acute and community trusts are viable for the future. And there's also a whole number of issues going on around, for example, if you're in Essex, we've got the Lampard inquiry underway, CQC issues and kind of finances, so lots going on in that space. Just thinking about primary care for a moment, obviously this emphasis on neighbourhoods is going to be a big focus for the future. Of course, general practice, community pharmacy, optometry, dentistry, if you like, have been, dealing with the kind of fallout from things like kind of national insurance increases and so on. We're seeing a lot of change around our universities. I think just a few days ago, for example, the University of Essex announced that they're going to be closing one of their campuses in Southend, resulting in a number of redundancies as well. So restrictions on overseas student numbers as well. But in terms of the role of innovators, and obviously universities are very closely linked with a lot of innovation, there are increased opportunities for innovators. Now, looking across the local government, again, all change, and government's announced that a move from having 2 tiers of local government, i.e. county councils for us and local district and borough councils, to single unitary authorities. And there's been, they've asked local areas to identify the profile of what that might look like. And there are a number of different business cases that have been worked up for having perhaps different numbers and different configurations of new unitary authorities. And those have been submitted at the end of September, and we're now awaiting decision from government about which profile is the one that we should move forward to. And we should hear about that in the spring. Local elections were, of course, delayed locally till May 2026, but we were originally expecting that alongside local elections, we would have mayoral elections for the new mayoral authorities for devolution in May 26, but of course we heard only last week that those have now been delayed till 2028, and there's some changes around send arrangements. Social care providers, I'm spending this afternoon with our local social care providers, and a whole range of different kind of issues at the moment. There is a piece of work going on to try and look at fairer pay in social care services. There's a number of changes to immigration which affect international staffing, and of course national insurance increases. And then last but not least, well, not quite last, voluntary community sector, we've got publication of a civil society covenant. And I always say that when there's change across the public sector, all of that, I think, always tends to magnify when it comes to our voluntary and community sector. So a lot of our organisations are reporting really, more significant funding pressures than they've ever faced in the past, and a whole load of impacting issues around everything from the impact of the recent budget, impact of short-term grants and kind of slow decision making, recruitment of volunteers, access to community resources, and their access to unrestricted funds. And of course, at the end of the day, it's our people and communities at the heart of this. So I've already mentioned the abolition of Health Watch, but in actual fact, the issues that people and communities always raise are remain the same. They want timely access to health and care services in the community. People are always concerned about waiting times, patient safety and quality issues, cost of living, deprivation, austerity, maintaining equitable, inclusive healthcare. So I've just spent a little bit of time on that slide, but the reason for it is to really just try and put across just how much is changing in terms of our health and care landscape. So the way that we've worked over the quite some time, if you like, in terms of the interactions, relationships between different organisations will fundamentally change because the organisations themselves are changing, and a lot of the people who hold those relationships, those organisations, are changing as well. So on the back of that, we've decided to do a little piece of work in towards the end of the life of the Suffolk and North East Essex integrated care system about our learning and legacy as an ICS going forward. The reasons for this are that all of our kind of co-chairs, if you like, as I said, the chairs for our partnership are not just the chair of the NHS ICB, but also the cabinet members responsible for health and wellbeing at Suffolk County Council and at Norfolk as well, have all agreed that it's really important that we build on some of the learning and legacy from what we've done previously. Yes, in Suffolk and North East Essex, I'm from Suffolk and North East Essex, but I'm sure the same would be true in Norfolk and Waveney, and think about what we've learned to make sure that we kind of build on that in terms of new arrangements for the future as well. And of course, it's probably going to take a little while to have some conversations about future arrangements because, as I've already explained, I'll show you again in a moment, the timeline for some of those new organisations to come into kind of being so that they can sit around the table and have that conversation is a little way out at the moment as well. So we are planning some joint meetings for Norfolk and Suffolk. We're planning a meeting in March or April to bring together some stakeholders who've been involved so far in Suffolk and also some from Norfolk and Waveney to talk about what we might do in Norfolk and Suffolk, and the same if some of you are interested in Essex as well. So we've got two key questions for our learning and legacy work. The first is, what have we learned about enabling effective system work in health and care based on our experience, and what has been our particular local interpretation of how we've worked together as a system, and what do we think should be the legacy from SNEE that should inform a reset and renewal of how system working is best enabled in the future. So I'm going to come back to those two questions. Those are the two questions for your breakout groups, which I'll come back to in just a minute. So as I said at the start, what do I mean by system? I do not just mean the NHS ICB. I know a lot of people muddle up NHS ICB with ICS. I mean the system. I mean everything that makes up health and care in its huge diversity, and creative health, and having so many creative health partners on the call is really exciting, because you are really, really key to health and wellbeing of our local population. So you are absolutely fundamentally part of what we should be thinking about as a health and care system. So which is why I'm so pleased to be getting your feedback this morning. And that's because we know that the things that drive people's health and well-being, yes, people's clinical care, bottom left, is important, but it's only about 20% of what drives people's health and well-being outcomes. Healthy behaviours, things like diet and exercise, and how much alcohol and whether we smoke and things like that are important too. But it's all of the other things that make up our lives that also drive our health and well-being. So just really quickly, in terms of the last 10 years, because I'm asking you the question, what have we learned from how we've worked together as an integrated care system? And it's been about 10 years that we've worked together increasingly more closely as integrated care systems. I just want to show you a few things. So during that period, this is some of the changes that have taken place in our population. So our population, first of all, has grown. Back in 2015, 10 years ago, the population for Suffolk and North East Essex, and I do apologise because I know we've got colleagues on the call from Norfolk as well, but for SNEE, just to give you some idea, and it'll probably be very similar in Norfolk, was about 957,000. The last measure we've got, 2023, it was just over 1.1 million. So that's an increase of around about 20%. And within that population growth, you can see that the proportion of people who are over the age of 65 has grown, if you like, that's experienced the biggest growth. So that's increased by over 30%. And you can see on the slide there a number of things. So, we had been experiencing an increase, a gradual kind of increase in kind of life expectancy. I've got my colleague Liesl on the call who can help me out with this if I get this wrong. But basically, we've started to see over recent years a kind of reduction in life expectancy, but also healthy life expectancy as well. So you can see some of those figures there. Of course, we've also experienced a whole range of kind of economic pressures over recent years as well. So you can see here kind of, the reductions in income equality as well. And then in terms of people's health wellbeing outcomes, we have seen, if you like, an increase, and this is probably largely associated with an ageing population in the prevalence of a number of different kind of long-term conditions as well. And there is some good news in this as well. So, for example, you'll see that the prevalence of smoking has gone down. That's a little bit of good news. You can see here that some of the changes around the number of babies born, low birth weight has remained fairly kind of steady. Prevalence of children who are overweight or obese in year 6 has increased, and so on. So you see some of the changes there. I'm going quickly because I want to allow time for conversation. And you can hear some of the other kind of changes that we've seen across the population. And we're going to be reporting on all of this in our report about the kind of last 10 years. The other way you can look at the last 10 years, and I'm not going to go through this in loads of detail, but this is the kind of last 10-year period. You can see across the top there some of the kind of key national events that took place during that period. And then underneath that has been, if you like, how policy has evolved around health and care system working. And at the bottom, if you like, the progress that we made as a Suffolk and North East Essex system. So in actual fact, Suffolk and North East Essex as a system was only identified just over 10 years ago in 2016. So it will have existed for literally bang on 10 years. Before we changed the boundaries. And in actual fact, SNEE was one of the first integrated care systems identified in 2018 Our voluntary sector assembly, in actual fact, came to being about 3 or 4 years ago. It started as some informal arrangements during the pandemic and then became much more formal over kind of recent years as well. So you'll see that this kind of comes up to date to some of the changes now in 2025. And over that timeline, we've been tracking some of the kind of changes and some of the kind of key events that have taken place at the top across NHS organisations, the middle, local government, and at the bottom, some of the kind of key things we can recall around voluntary community sector. We could add many more in there. And then, Lisa, were you just going to very quickly talk about the kind of key developments around creative health, because this is your slide?
And it's really just to pick out, and these are just some of the things that have changed around creative health. So I've actually gone back to 2012 for when the Norfolk and Suffolk Culture Board was established. But I think things really started to gather momentum at the point that the All-Party Parliamentary Group on Arts, Health and Wellbeing started the inquiry into practice and research in the arts, health and social care, because that then triggered the production of the report in 2017 on creative health. And in 2020, there was the evidence summary for policy that came out. So we've seen really that sort of at a very national level, things have started to gather momentum. There's been some very, very strong evidence that's been produced. And that's then begun to gather momentum more locally, particularly with things like the Suffolk Annual Public Health Report, focusing particularly on working with the cultural sector and improving health and well-being, and thinking about arts and creativity and the contribution that's got to make. And now we've got the Creative Health Toolkit. We recently held a Thinking Differently Together event about creative health. So it's certainly increasing its profile over that time period. That was all I was going to say on that one.
Brilliant, thank you. So what I've just rattled through quickly there is a little bit about kind of the period of which we have, been working together, and some of what's happened during that period that we might want to reflect on in terms of kind of some of our learning. But just very quickly in terms of kind of going forward, this is some idea of the road ahead. So if you're on the bottom left, you'll see new ICBs will come into effect from the beginning of April, but they're going to need to wait a little while before some of the changes with colleagues in kind of local government take effect, because it will probably be around about that time we'll get a decision on what the profile of new unitary authorities looks like, and then new shadow authorities from 2027, with new unitary authorities coming into place in April 28, and mayoral elections, as we heard last week, put off now till May 2028. It doesn't mean that a combined authority couldn't be formed in advance of that, but it wouldn't have an elected mayor. And the other thing worth just bearing in mind is during that time period, of course, a lot of the things that have been announced are subject to amendments to legislation. So there's two big bits of legislation I think worth keeping an eye on. First of all is amendments to the Health and Care Act, which is, of course, would need to be amended to abolish officially NHS England and Health Watch and ICPs and things like that. And also the English Devolution and Community Empowerment Bill. Those two bits of legislation would be making progress as well through kind of all the appropriate democratic processes. So that's my rattle through bit of kind of introduction, just to give you a flavour of the kind of landscape, the very shifting landscape that we're in. And what we want to do is to go to breakout groups, and we've got sort of two discussion questions for you. So the first is, again, what can we learn from, how we've worked together over the last ICS, which has been an evolution. And we're particularly interested in, from your perspective, from a creative health perspective, because we're having these conversations in so many places at the moment, where have we been able to have an impact? What are the things we've begun to do differently that have worked well? What have been the most effective aspects of kind of our governance or working arrangements, and what's enabled progress? And also, where have the challenges and barriers been as well? So that's the first kind of theme that for the breakouts. And the second is about that legacy. So now going forward into this new landscape, how should our legacy, because we've been working as an ICS with a certain set of partners in the past, we're going to be working with a different set of partners, and very likely new arrangements going forward into the future. How should our legacy enable us to continue to make progress together? So thinking about the opportunity here, we've got to kind of reset and renew, because I personally don't think that ICS has ever had it absolutely right, and so on. Where is there an opportunity now to maybe do things better? You know, what do we need to keep doing and why, and where are our opportunities to do things better for the future? So those are the two questions we'd like your feedback on this morning. And Claire, I'm going to stop sharing slides now. And I'm happy to take any questions, but myself and Rachel and Lisa are going to be across the breakout groups, and we're all happy to chat in the breakout groups if that's helpful.
Yeah, so I'm going to assign everybody to a breakout room now, and as Susannah said, you will have a lead in each of the rooms who you can ask questions to and of. And anyone who doesn't get assigned a room, because some people I was unable to assign them into a room, I'm not sure why, if it's a glitch or it's something in your settings, you'll stay here in the main room with me and we can have a conversation. So I'm going to open the rooms now and see you soon. So I just want to reiterate Susannah's point there and just thank you all for your feedback and your input. I think it's really important moving forward that we are able to convene and get together and you know, and talk this, because this is big work. This is systems change work, so it's not easy, it's not quick, and your input is valuable and very much wanted. So with that in mind, what I'm going to do is I'm just going to talk you through kind of the next steps for what's going to happen with CHIMe. So the next meeting that we are going to put in the diary is for Wednesday, the 14th of January from 10 until 11:30. And in this meeting, what we're going to be talking about is the place-based partnership application that the Culture Board are putting together for Arts Council England. And I'm leading on a strand of work around workforce development. And so between now and then, I know you've got Christmas and you're probably not going to want to think about this while you're eating your Christmas dinner, but I just wanted to drop it in and kind of so you have an idea that you can maybe be thinking about this in the back of your brain. But what skills or learning would you like to have to enable you to develop in your role? This will all come out on an email to you, but I wanted to kind of talk about it with you now. And then the final thing to end this will be an evaluation board, and I'm trying to do evaluation differently because we're all you know, we're all get very jaded with it, and what you will see is that I'm going to pop a link in the chat to the evaluation, and there's some post-it notes, and I just want you to pop place an emoji reaction against the statements you agree with. And then if you've got any feedback, there's some blank post-it notes on the board as well. So I will put a link in the chat now for you to go to that and drop your thoughts into to that. And yeah, if in terms of I'll just consider some questions. If anybody has any questions, then feel free to pop your hand up, raise your hand, and we can come to those as well. And to answer your question, Lorna, the January session is aimed at anybody that's interested in creative health. So it isn't sector specific, but it's just people that want to continue to come together to work out a way that we can effectively create the system change to enable Norfolk and Suffolk to be a creative health region in the next 10 years. So anybody that wants to add their voice to that conversation is very, very welcome. And if you do know of anybody that you think should be at this meeting and isn't, then please feel free to give them my email and ask them to get in touch, and I'll pop it in the chat now. You should all have it anyway, but it's in the chat. And yeah, if does anybody have any questions that they want to ask, raise your hand and I will come to you. Or are you all busy filling in the evaluation? Because we love evaluation, don't we?
Hi, Claire. I just had a quick question. I was wondering if we could get maybe the contacts for the other kind of key people from this meeting, like Susannah or Rachel, or anyone else you think would be a key contact we should reach out to.
I mean, in terms of kind of protecting their inboxes, we're not going to be giving out their contact details. I am the conduit for that kind of information. So anything you feel that needs to be shared or that needs to be discussed, if you email me in the first instance, and then we can then arrange to see what needs to happen moving forward. This presentation has been recorded. And we are going to be sending it out for other people who weren't able to make it today. But yes, in terms of sharing contacts, obviously that's a whole GDPR thing that I don't have capacity for at the moment. But moving forward, it could be a vehicle for us, but not off the back of today's meeting. Lisa, I can see you've got your hand up. Do you want to unmute?
Yeah, all I was going to say, Claire, is recognising that some of the discussions today, they're quite big, almost philosophical questions. And I don't doubt for a moment that people have thoughts afterwards and of things that they think, oh, I wish I'd said that, or I hadn't thought of that at the time. But please keep it coming. I'm more than, I shall put my email address in the chat for you. If you do have any further thoughts or case studies in particular that we can use to feed into the Legacy and Learning project and the report that comes out, I'm more than happy to receive them. That was all I was going to say.
Thank you. Does that answer your question, Robert? Maybe not in the way that you wanted, but does that give you a response that you're happy with?
Yeah, no, that's all good. I just wanted to make sure we had the contacts for whoever is our conduits, essentially.
Fantastic. Daisy, I can see your hand is raised.
Oh yeah, just to say I'm finding it hard to access the chat. So please could the evaluation form and the link to the sticky note gizmo, please could it be emailed?
Absolutely, yeah. What I'll do is I'll pop it on the follow-up email, and anyone who isn't able to get onto the Miro board can put their thoughts and feedback onto it. Yeah, thanks, Daisy.
Thank you.
I can see that you're all on the Miro board, putting in your thoughts. Any other questions or anything else that anyone else wants to say? Daisy? Daisy, you're on mute.
Okay, me again. Sorry. I feel like quite a lot of conversation in the breakout room was around funding and the kind of start-stop process for the arts, for artists and creative organisations. And I think we had a long talk about that, about what the resources for creative practitioners to work with in creative health, to develop creative health projects with health organisations. And I just had I mean, it might sound like just maybe, I'm sure lots of people have thought of this before. I really don't think this is groundbreaking, right? But imagine if the NHS were to develop artist commissions, long-term artist commissions. Imagine if the health service would work with arts organisations or individuals who have experience of curation or project management or commissioning artists. Imagine if there were long-term art projects really integrated within that healthcare system, and residencies, artist residencies as well. And imagine if there were if there was lots of opportunity for contracted employment for brilliant artists, brilliant creative practitioners to work within the healthcare system. That's all I wanted to say. I'm sure everyone's thought of that before.
Yeah, I mean, I don't know if Rachel or Liesl wants to respond to that, but I absolutely wholeheartedly agree. And I think that with all the system change that's going on, we have an opportunity to maybe raise that and to kind of advocate for that if we feel that that is, you know, is an area that we feel would benefit, which, you know, we do, but it's providing the evidence and kind of the and when I say evidence, I don't mean that I mean that in its broadest sense. It's about making the case. It's about kind of putting together a you know, a cohesive kind of package to say this we feel would be beneficial, and to co-produce that, you know, in a way that kind of brings the healthcare commissioners in line with our thinking, rather than it being us going and asking for money. I think there needs to be kind of this knowledge exchange that happens before we get to that point where, you know, where the value of creative practice and creative health, you know, non-clinical interventions is really valued, and so that we're not coming to the table kind of with our begging bowl, but we're coming to the table as an equal partner. So hopefully that's kind of the area that I'm sitting in now, and that's what I'm hoping to do, and using these meetings as a vehicle for that. So yeah, thanks, Daisy. Rachel, I can see your hand is up. Did you want to respond to that?
I'll be super quick because others have got their hands up, but to go, absolutely, I 100% agree with Daisy. And we were discussing in our group about, you know, there isn't that equal partnership between our arts our arts organisations, and the same with our voluntary sector as well, and recognising many arts organisations are also voluntary sector, and we need to do better. You do feel positive about things like the creative health working group and things. It is happening, but it's too slow, and arts, similarly to voluntary sector, are always seen as the nice to have and the first to go, and we all know on this call, we know that that's not right, but there is more work to do. But I'll let others speak. Thank you.
Simon, I can see you've had your hand up for a while. Do you want to speak to that?
Not necessarily that. I mean, I agree with all of that, obviously. But I think I just wanted to flag, what's the intersection with what we're doing here and the NHS sort of East of England social impact framework? Does anybody have any ideas or clarity about that?
Rachel, I think that might be one for you.
Are you referring to the procurement social impact framework? Yeah, I mean, so again, I don't want to take up too much time. Our feedback on behalf of the VCFSE Assembly has been that framework is good in principle, but isn't right in practice. The first process and that open call presented a huge amount of barriers, and not as many people were able to complete the process as needed to. So we went back to them and said, we think that it's worth looking at, but we think you need to do more training and support to support the voluntary sector, because at the moment there's maybe 10, 15 organisations on there that clearly isn't reflective of the breadth of our voluntary sector. So actually, instead of opening up opportunities, it creates more challenges and sort of creates even sort of less equality there between those organisations. So it's not right, but we have spoke to them and said they need to come back and do some work. And we offered on behalf of the Assembly would need to be remunerated for that, but to do that co-production to fix it, because yeah.
But will that framework, do we think, be the conduit for larger amounts of commissioning though?
Possibly. That hasn't been committed to yet, and I know I've just met with Norfolk and Wellbeing this morning actually, and their procurement leaders exploring that to go, well, what does that mean for us as an organisation, and what would that look like? So nothing has been confirmed, but it does feel like there's opportunities there, but it's not quite right at the moment for a number of different reasons.
Thanks.
Thank you, Rachel. So I can't see any more hands up. So what I will do is draw this meeting to a close. Thank you all for your time today and your valuable contributions. Have a very happy Christmas and hopefully I'll see you all again in 2026 for our next CHIME meeting so that we can continue to work together effectively to see the change that we really, really feel passionately about. So thank you, everybody. It's been really great.